Dr. Patel, we talked in another video about time and fear patients have. We also talked about the money part, but right now I want to ask you about two things, time and fear. And you did mention in another video that you have extended office hours and all that, and that's wonderful because, yeah, I mean, who wants to take off from work, which isn't so easy because we're worried not to have a job anymore after that.
Sure.
Blah, blah, blah. Besides, we have forget about worried about not having a job. We do have a responsibility. Most of us actually are responsible at work. We want to do a good job, and we know to do that, we need to be there. So there's the extended office hours, and the new technology really is so that dentistry doesn't hurt anymore. You know, even getting an injection, there's this little tiny things you do before, so the gum gets a little numbed and it tastes even good. So nothing is happening anymore, really, if we really look at it. But then there's this other thing called sedation dentistry for the real, you know, dental cowards, for the real fearful guy. And now they are like in a really good shape. But there's also the time factor involved because apparently that means you could do a roundhouse, meaning you could do 5, 6, 10 procedures all in one, which otherwise the patient couldn't stand, which means, again, he's there 3, 4 hours, or a good morning or a good afternoon, feels like it just was a cup of coffee, walks away and had a lots of work done. So you're handling two things with sedation dentistry, true or not?
No, you're absolutely right. You know, there are different levels of anxiety that patients usually present with. The biggest being that with the needle. That being said, the needle is something that no one is too fond of. So we have different technological advancements here in the facility, which we use where patients do not feel the needle as much as they normally would. Now, for those who have more anxiety or fearfulness due to past experiences with other dental providers, there are various forms of sedation dentistry that we have here. The lowest being nitrous oxide gas, which is laughing gas, where you could, you know, have the dentistry done under a anti-anxiety climate. Then you also have IV sedation. You know, the most ideal situation is to have as much done in the dental chair and minimize the number of visits that you have with the dentist. So in an ideal situation, IV sedation is amazing, where patients come in. We have a licensed anesthesiologist who comes in. They sit by the patient's side throughout the entire appointment, sedate the patient, and while we go in there and accomplish what we have to accomplish. And you're absolutely correct. It could be for something as small as having a tooth taken out to something as having full mouth rehabilitation or cosmetic dentistry or implant dentistry done.
So it doesn't have to come, the patient then doesn't have to come 3, 4, 5, 6 times. It can all be done in one shot. And that's always time. And, you know, as I said, every time you say, we always, wouldn't matter how we know it doesn't hurt. We still have that apprehension walking into that office. So if I only have it once and I'm done, I'm sure that's appealing to lots of people. Do lots of people take advantage of it?
Absolutely, and a lot of patients do take advantages of it, whether there is an anxiety proponent to their thinking or not. Patients do not get sedated only for anxiety. Like you mentioned, and like we had a conversation earlier, you know, a lot of patients, they don't wish to take multiple days off of work or multiple time away from family and friends to come visit the dentist to have multiple procedures done. So this is a very quick, inexpensive and adequate way of the patients accomplishing a lot of dental care if needed in one sitting, which is always an ideal situation.
Wonderful. So sedation dentistry, time and anxiety are two things it really handles, and apparently the office visit literally flies by. Once you get that sedation, before you know it, the doctor says, you're done. Apparently, even though he may have worked on you for 6 hours.
Correct. For us, it may be 3, 4, 5, 6 hours, but for the patient, They just went to sleep and they just woke up 5 minutes later and everything is done and they don't remember a darn thing, which is the best part.
And it's not dangerous.
Absolutely not. This sedation dentistry that we speak of is not deep sedation, which is what must happen in a hospital setting. It is basically a form of conscious sedation where the patient is sleeping, they're out, but they're still responsive to our commands. When we tell the patient to open or close or turn their head to the left or the right, they're still completely there. It's just you're not knowing what's going on and you're consciously just responding to us.
What about if the patient, I don't know, wants a glass of water, wants to go to the bathroom, especially if it's a long procedure? Will he be able to voice that? Will he be, or will you be able to ask him and he says yes and then he goes? And how does that work?
Well, usually 9 out of 10 times the patient, we usually take these measures ahead of time, have the patient visit the restroom. But no, if there is a need to bring the patient back, if they wish to use the restroom, which once you're sedated, you won't have the desire to do certain things except for because you're essentially sleeping. But if, God forbid, there is a need, which would never occur, we have the ability of bringing the patient back to a conscious state and wheeling them and aiding them in using the restroom and bringing them back and finishing up with the procedure.
Another, should we call it high-tech thing to actually give us comfort? Absolutely wonderful. Absolutely wonderful to hear the progress which has been made there. Yeah, basically, to make it better, nicer, more beautiful for us. Thank you very much, Dr. Patel.
Absolutely. Thank you.